Good morning, everybody. Thank you all for coming out here today. I'd like to recognize Councilman Hollander for being here and helping us with all of his good work. Thank you. And the deputy mayor's back there with him as well, Ellen Hessen. Thank you. You might recall when I took office 9 years ago, I made health one of the core values of my administration, along with lifelong learning and compassion. And we all know that without health, it's hard really to function in any kind of way. So we define our city value of health to include both physical and mental health, as well as population health and environmental health, because it's the combination of all these factors that are required to help us understand the factors that influence the length and quality of our lives. And we have to look at all these through those lenses, and we have to understand why there's such disparities in health outcomes along demographic lines like race, income, and zip code. And those disparities are unacceptable. We all deserve to live a long and healthy life, and that should be one of the purposes of government, to live longer and to live in a more healthy way as well. So we've been working hard over these past 9 years and counting to address those disparities and all of our population health challenges, and to find ways to create a city that is healthier in every sense of the word. And fortunately, our work is good quality. It's been validated by national organizations such as City Health, which ranks America's top 40 cities on health policy. The CDC said our Department of Public Health and Wellness set the gold standard for its response to the hepatitis A outbreak. So good job to Dr. Moyer and the Public Health and Wellness team. Let's give them a round of applause. Nice job. And I really love our Healthy Start program. It's been a huge success, helping expectant and new parents in targeted low-income neighborhoods have healthy full-term babies and thriving families. And 2 years ago, we published Coming Together for Hope, Healing, and Recovery. And it was our plan to respond to the evil opioid crisis. Fortunately, we're seeing results. The crisis is still with us, but we're improving. According to the Kentucky Office for Drug Policy and the Jefferson County Coroner's Office, overdose deaths in Louisville fell 21% in 2018. That was the largest decrease of any county in the state. So while that's progress, we still have a lot to do. Now, process is important because we made progress in these and other areas by gathering and studying data, by consulting with experts and community partners, and most importantly, by listening to what the people of Louisville had to say about their health and their health challenges. And all of this input is important as we determine what the next steps should be. So this is a similar process that led us to create the plan that we're releasing today. Healthy Louisville 2025 is the result of a 3-year in-depth research, consultation, and conversation about the health of our city. This includes surveying more than 3,500 Louisville residents on their priorities for improving community health in our great city. We sent surveys out in 6 languages, and we had 8 different focus groups. We also convened community and public health leaders multiple times to consider what trends, threats, and opportunities could impact community health in Louisville. And it was through these conversations that we gained a greater understanding of the challenges we face and the partnerships that we need in order to meet the challenges. And we really are blessed with great community partners like Kathy Hinkle of the Metropolitan Housing Coalition, Ted Smith and Ray Yeager, who are representing the Envirome Institute at the University of Louisville School of Medicine, Humana and the work that they're doing on their bold goal. I know that's not the right current term, but it's close enough, right? What is the current term? Oh, it is? Okay. All right. Well, I shouldn't suspect myself, but Humana's been there with us in the trenches as well. So all this, we're making progress, but we're never going to be finished on something like this. So we're going to hear from some of these folks in a moment to inform us more about our focus areas that we've identified as a result of the community work that has been accomplished on this plan. So we have 4 major areas of focus. We must build healthy neighborhoods, ensure equitable housing, achieve environmental equity, and create healthy schools. So these goals obviously embody or overlap with our core city values of health, lifelong learning, and compassion. So it's great to see that alignment. This plan also aligns with the work we're doing throughout Metro government, including our Office for Safe and Healthy Neighborhoods, our Office of Resilience and Community Services, and Louisville Forward and Develop Louisville, which oversee our affordable housing investments. This plan also aligns with our work to provide more robust support services to our children and families through the community's collective impact model that we call Evolve 502. It's the system of lifelong learning from cradle throughout the career. So in many ways, Healthy Louisville 2025 is really a great roadmap for us to become a healthier city. So I encourage all citizens to be informed and get involved, and then if they need to change habits to live a healthier life and help us change policies as well, we welcome their input. So to discuss the details of our plan, I'd like to bring up Dr. Sarah Moyer. She's the Director of the Department of Public Health and Wellness and our city's Chief Health Strategist. Please welcome Dr. Moyer.
Good morning. Thank you, Mayor Fisher. Healthy Louisville 2025 is a roadmap to a healthy Louisville where everyone and every community thrives. The roadmap's necessary because currently, where you live in Louisville has more impact on your health than the health care you receive or the lifestyle choices you make. If you're a pregnant woman in Northwest Jefferson County, you're over 6 times more likely to lose your infant than a pregnant woman in Southeast Jefferson County. Residents in Metro Council District 16 experience less than 1 vehicle crash per square mile, while residents in Council District 6 experience almost 80. Neighbors born in some census tracts in our city live less than 64 years, while neighbors born in others live more than 86. Individual behavior and choices alone are not enough to account for these differences in health in various areas throughout our city. More of our health status is determined by root causes of health, the underlying social, political, physical, and economic environments. We need systemic change to these root causes if we're going to improve the health of our community. I'm passionate about this work because when we build strong, healthy roots in our community that nourish every resident, everyone benefits with longer, healthier, and happier lives. And that's why I'm proud to be here today to announce that how our community is coming together to do just that with Healthy Louisville 2025. It's our Community Health Improvement Plan. A Community Health Improvement Plan is a process where we identify what our community feels are their most important needs, and then use data and public health best practices to work together as a community to better meet those needs. Because working together has a greater impact on health and economic vitality than working alone, Healthy Louisville 2025 has brought together the community, healthcare providers, our public health team, and more than 80 other stakeholders to consider high priority actions to improve community health. I want to say a big thank you for being part of this process, everyone here and everyone watching, and especially thank you to our Center for Health Equity team led by T. Gonzalez and Angela Graham for leading this work. Thank you, guys. So it's been a long and thorough process starting in 2017 and 2018 when residents from every neighborhood took our community health needs assessment survey. We then held focus groups and community meetings where people went into more depth about what they felt our community needed to be healthy. In the fall of 2018, we invited community leaders and partners to look at the results of that community health needs assessment and the data from the 2017 Health Equity Report and help us identify the areas where we can have the greatest impact together to improve the lives of everyone in Louisville. Our community partners and stakeholders identified 4 key areas for improvement. One is building healthy neighborhoods. The second is ensuring equitable housing. Third is achieving environmental equity. And fourth is creating healthy schools. These 4 areas are critical because it's difficult to achieve a healthy life without them. And we're all held back from reaching our full potential when some of us are denied the tools to achieve good health. Healthy Louisville 2025 is not a report, it's an evolving plan. Everyone is invited to track our progress and everyone is invited to participate. We need you to join us because improving health and ensuring health equity requires all of us. So please check out our website. It's healthylouisville2025.com. And so I invite you to dive in, check out the data, see some of the work already in progress, and then let us know which focus area is important to you and how you'd like to get involved. 2 of our goal owners and partners are here today and will share why Healthy Louisville 2025 is important to them. First is going to be Kathy Hinko, the Executive Director of the Metropolitan Housing Coalition. Kathy and her work group own the goal of ensuring equitable housing. And then following Kathy will be Ray Yeager, Assistant Professor of Environmental Occupation Health Sciences at the University of Louisville School of Public Health and a member of the Environment Institute at the University of Louisville School of Medicine. Ray and his work group own Healthy Louisville 2025 goal, Achieving Environmental Equity. So Kathy, come on up.
So the Metropolitan Housing Coalition facilitates research-based advocacy for fair housing and affordable housing. And in the office, it's just me and Tony. But why did we take ownership of this? We took ownership because where you live isn't only a factor in health, it's a factor in what your probability is of success in the world. And we took this because this administration isn't just about the health part. It's about changing our comprehensive plan, which was done. It's about the transportation plan, which was done. It's about what Air Pollution Control District is doing. We knew with such a widespread focus that we could take on this task and help be a part of this. Now, why is health so important to housing? Even the health providers now call it social determinants of health, but it's the social determinants of everything. Our economy, it's our how our children succeed. Look, any one child can succeed and can score a run, but wouldn't it be better if all our children were born on third base? And housing plays a major role in that. We know from redlining, which is still in effect in many ways about how you get financing for housing. We know about zoning, which 100 years ago, effectively the council put in a scheme of block by block, whether white people or black people could live there. They came up with another scheme, but that zoning is still in effect. And we know that the practices of real estate in steering and causing fear still exist because half of all black homeowners live in only 22 of 198 census tracts. So housing is an important part of expanding people's choices and consequently their future development and their health. But I have to applaud that so many parts of the administration really are contributing to this. Thank you.
Thank you for the invitation to be here today, and especially for the invitation to collaborate on Healthy Louisville 2025. At the Environment Institute at the University of Louisville, we firmly believe that the environment is a root cause of health. The air we breathe, the food we eat, the places we go, and so much more affect the health and well-being of Louisville. Over the past 2 years, the Institute has collaborated with Metro Public Health and Wellness to form a close relationship on a number of projects to develop and apply scientific evidence to improve health and environmental equity in Louisville. We are especially proud to assist with the environmental goals of Healthy Louisville 2025 in close collaboration with the Health Department. We have worked with Louisville communities on numerous environmental root causes of health in our community. Through this process, these collaborations have turned cutting-edge research into public health policy and practice. The integration of this research into Healthy Louisville 2025, alongside expertise in policy development, community engagement, and various other expertise at the Health Department, represents a major success where partnerships have achieved more together than our organizations could have ever achieved by working separately. It's one thing for us to conduct research leading to findings about the relationship between environmental influences and health, but to take those findings, to engage with communities, to develop policy, and to positively influence the health, well-being, and equity of our communities for the better is really something special. As scientists, we are often separated from public health action that is based on our findings, so we are incredibly lucky and proud to see that our research and expertise is being put to direct use by our community to advance health in Louisville. Through Healthy Louisville 2025 and beyond, we look forward to continuing close collaboration with the health department and community in achieving goals laid out in the report. With these collaborations, we have numerous projects on the horizon to create new environmental health knowledge and action. These partnerships are essential to both advancing scientific knowledge and improving health. Just one of several examples includes our partnership with the health department on including satellite measurements of greenness into the data that supports Healthy Louisville 2025. This collaboration has gone on to inform work with NYU and NASA to build national-level greenness data sets for use by communities and policymakers to improve health nationwide. These further steps and national expertise will then lead to even greater opportunities that can focus on achieving health equity in Louisville. Through these collaborations, we look forward to achieving more together to positively affect the health of our community through our environment. Thank you.
Well, I'd like to thank everybody for coming today. I want to recognize Keith Tatley, who's here. He's our director of our Air Pollution Control District, and he and his team have done a great job stabilizing our department and improving the quality of our air, and we know that's an ongoing challenge, but Keith, you guys have done a great job. Thank you, guys. So I want to thank all of our partners as well. Obviously, our work's never going to be done, but it's plans like this and days like this that help us stop and take stock after we've heard from all of our stakeholders so that we can make sure that we're building an even healthier city. So thanks everybody for coming out today.